HPV is so common that nearly all sexually active men and women get it at some point in their lives, but the symptoms? They're elusive, often invisible, making it a silent invader in our bodies. But what happens when these symptoms do decide to show up? And how do they impact our health in ways we might never have imagined? Stay tuned as we uncover the hidden signs of HPV, a disease that's as common as it is misunderstood. HPV, or human papillomavirus, is one of the most common sexually transmitted infections worldwide, affecting people of all ages and demographics. It is estimated that the vast majority of sexually active individuals will be infected with HPV at some point in their lives. This high prevalence is due in part to the variety of the virus, with over 100 different types, each affecting the body differently. Furthermore, the ease of virus transmission, which can occur through intimate skin-to-skin contact even in the absence of complete sexual intercourse, contributes to its widespread dissemination. Despite its high rate of contagion, most HPV infections are transient, naturally cleared by the immune system within a 2-year period. However, in some cases, the virus can persist in the body, leading to more serious complications such as precancerous lesions and cancers, especially cervical cancer. The prevalence of HPV is particularly high among young adults, who are more likely to have multiple sexual partners and, consequently, greater exposure to the virus. HPV vaccination, recommended for preteens and young adults, has emerged as a critical tool in the fight against the virus's spread, offering protection against the most common and dangerous types of HPV responsible for the majority of cervical cancer cases. The link between HPV, human papillomavirus, and cervical cancer is one of the strongest and most significant in modern medicine. This virus, particularly its high-risk types like HPV 16 and 18, is recognized as the primary risk factor for the development of cervical cancer. In most cases, HPV infection is asymptomatic and transient, but when the virus persists in the body, it can cause cellular changes in the cervix. These changes, initially precancerous, can slowly evolve into cervical cancer if not detected and treated in time. This process can take several years, providing a window of opportunity for early detection and intervention. Prevention and early diagnosis play a crucial role in the fight against cervical cancer. Screening tests, such as the Pap smear, are essential for detecting precancerous changes in the cervix before they progress to a more severe stage. Additionally, HPV vaccination, recommended for girls and boys before the onset of sexual activity, has been shown to be effective in preventing infections by the types of HPV most associated with cervical cancer. Awareness of the importance of vaccination and regular screenings is vital to reducing the incidence and mortality associated with cervical cancer, a preventable disease that, when diagnosed early, is often treatable with success. The symptoms of HPV, human papillomavirus, vary widely depending on the virus type and the area of the body affected. In many cases, HPV is completely asymptomatic. If what I've shared so far has resonated with you, I have something special that will interest you. Don't miss the opportunity to transform your life and start living your healthiest self today. By acquiring the ebook Secrets to Unshakable Health, you will have a guide with practical and proven strategies for living a longer, disease-free life. Click on the link in the first pinned comment and discover the path to lasting and robust health. The diagnosis of HPV typically begins with a physical examination of any present warts. For women, the Pap smear is a crucial tool for detecting cervical cell changes that may indicate an HPV infection. In some cases, a colposcopy may be performed, a procedure that uses an instrument with a magnifying lens to closely examine the cervix, vagina, and vulva. For high-risk HPV types, specific tests can be conducted to identify the presence of the virus. These tests are important as they allow for the early detection of precancerous lesions, increasing the chances of effective treatment and prevention of cancer development. Vaccination remains the most effective way to prevent HPV infection, especially for high-risk types associated with various forms of cancer. Mortality rates associated with HPV, human papillomavirus, are significantly influenced by two main factors: the type of HPV and the early detection and treatment of conditions caused by the virus. High-risk HPV types are known for their ability to cause cancers, including cervical, throat, anal, penile, vaginal, and vulvar cancer. Cervical cancer, in particular, stands out as one of the leading causes of HPV-related deaths among women worldwide. In many regions, especially where access to routine screenings and treatments is limited, mortality rates remain high. However, in countries with effective screening programs and access to treatment, there has been a significant decrease in deaths from cervical cancer. Preventing HPV and related diseases begins with vaccination. The HPV vaccine, recommended for preteens and young adults, provides protection against the most common and dangerous types of the virus, including those most frequently leading to cancer development. In addition to vaccination, regular screening tests, such as the Pap smear for women, are crucial for detecting precancerous changes in the cervix. These tests allow for early interventions that can prevent cancer development. Education on safe sexual practices and awareness of HPV also play a significant role in prevention. The combination of vaccination, regular screening, and education provides the most effective tools to reduce HPV-related mortality rates and limit its spread. Preventing HPV, human papillomavirus, is paramount in the fight against diseases associated with this virus, including various types of cancer and genital warts. The primary prevention strategy is vaccination, which has proven highly effective in protecting against the most common and dangerous HPV types. Different vaccines are available that cover various HPV types, especially those most frequently associated with cervical cancer. Vaccination is recommended for preteens and young adults before the onset of sexual activity, as it is most effective when administered before any exposure to the virus. Furthermore, in many countries, mass vaccination programs have been implemented, aiming to significantly reduce HPV prevalence and, consequently, the incidence of cervical cancer and other related diseases. In addition to vaccination, there are other important measures for preventing HPV. Regular screening tests, such as the Pap smear for women, are crucial for detecting early changes in the cervix that may indicate a high-risk HPV infection. The use of condoms during sexual intercourse can also reduce, but not completely eliminate, the risk of HPV transmission, as the virus can be transmitted through skin-to-skin contact in areas not covered by the condom. Education on sexual health and HPV is another vital tool, helping people understand the risks and the importance of vaccination and regular screening. By combining vaccination, screening tests, and education, it is possible to effectively combat the spread of HPV and significantly reduce the risk of associated diseases. We've reached the end of our video, where we explored the symptoms of HPV, a silent but potentially dangerous disease. We've seen how the human papillomavirus can manifest in different ways and the importance of being attentive to signs that often go unnoticed. Prevention through vaccination and regular screenings is the key to combating this virus and its potential serious complications, including different types of cancer. Remember, information is our greatest ally in health. Stay informed and don't hesitate to seek guidance from a healthcare professional for regular checkups. Your well-being and health are priorities, and small preventive actions can make a big difference. If you found this video informative and helpful, don't forget to leave a like and share it with friends and family. These simple actions help spread vital knowledge that can save lives. And if you're not already subscribed to the Health Dose channel, subscribe now for more content on health and cardiology, always explained in a clear and concise manner. Together, we can build a healthier and more informed community. Thank you for watching, and until the next video.